Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health podcast is about optimizing all of us. Here we cover the cutting-edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. wildhealth.com for all the information on becoming a patient or working with us.
Everybody, welcome back to the Wild Health Podcast. I have with me here today Dr. Alex Carl. Dr. Carl and I have been talking for months trying to get him on the podcast to talk about air quality, air pollution, and what we can do about it in our own homes. It's been challenging to make our schedules work, and ironically, they happen to work today of all days, a day where the state that I live in, Oregon, is pretty much completely on fire. Homes have been completely devastated. People have been run out of their homes, and we've even had loss of life. And with that has come atrocious air quality, which is at this point all over the Pacific Northwest, including California as well. So pretty much the entire West Coast, with numbers of PM 2.5 in the mid 500s, which if you don't know what that is, you're on the right podcast because we're going to be talking about it a little bit with Dr. Carl. So Dr. Carl is currently in Louisville. He's the assistant professor of physiology in the Diabetes and Obesity Center at the C.L. Brown Envirome Institute at the School of Medicine of Louisville. Alex, thanks for coming on the podcast. It's great to have you.
Thank you for having me. Very, very glad to finally be able to make it.
Yeah, definitely. And I'm glad personally, on a very personal level, to have you here now to talk with you about this because when I look outside, I can barely see the next house from all the poor air quality I'm currently living in my house. So I'm interested to hear what we can learn from you today. Alex, how did you get interested in air quality in the first place? And I guess tell me a little bit more about your research currently.
Well, I'm glad you asked that actually in the context of mentioning the visibility, because that was probably my first inroad into concerns about air pollution. I'm from South Carolina, as are you actually, obviously. And I went to Montana to Glacier National Park and was blown away by how vividly blue and pristine the air was there. And then I went backpacking in Great Smoky Mountains National Park and was actually shocked at how poor the visibility was on a perfectly sunny day with not a cloud visible in the sky. You look down from the top of a bald. I was at Gregory's Bald, and couldn't tell if I was looking into the valley at a river or a road, and it kind of irked me. So that I think that planted the seed. And then when I was in undergraduate at Duke, I took an Intro to Environmental Science and Policy course, learned about the national parks and how Great Smoky Mountain National Park is one of the most polluted, if not the very most polluted park in the nation. Then took a hiking trip with my then girlfriend who had an extreme asthma attack, the worst she'd ever had, on a sunny July day up in the mountains. And it was clear from the visibility, sort of the yellow of the sky, that there was a major air pollution problem that day. And, she was in tears because she couldn't move forward. So we basically had to give up the backpacking trip for that reason. And that just it far more than irked me. It inspired me to try to do something about air pollution. And the first thing that I wanted to do was learn about it, try to understand why it is that people have adverse reactions to air pollution, and then kind of delve into the different manifestations of adverse reactions to air pollutants. So my research now, it's deviated a little bit very recently into electronic cigarettes and how they adversely affect the heart. But since I started my doctoral research at the U.S. Environmental Protection Agency and UNC Chapel Hill, as I was working towards my doctorate, I was working in a lab at the U.S. EPA, studying the adverse effects on the heart of diesel exhaust exposure in rats. And I mean, that captivated me. So I've just kind of continued onward with a particular focus on the cardiac and sort of a side focus on the pulmonary effects of inhaled toxins, especially air pollution, and more recently, electronic cigarette aerosols.
I've always been pretty worried about rat hearts and their response to diesel exhaust. Tell us tell us a little bit more about the effects of pollution on what we know on the effects of pollution on humans. Is it isolated to the heart, or are we seeing these effects in different areas like cancer, insulin resistance, diabetes, obesity, lung disease? I don't know.
Mm-hmm. Yeah, excellent question. So the adverse impacts of air pollution are shockingly diverse. And just as you were suggesting by asking, I mean, there are clear impacts of air pollution exposure on insulin resistance, and therefore promoting obesity, on diabetes, as a consequence as well. And on the heart, as mentioned earlier, on the lungs, of course, and in terms of cancer, especially lung cancer, there's clear impacts. And so, as I mentioned, I do animal research, but sort of the connection there is that we started realizing in the field of air pollution, toxicology, and epidemiology that there were correlations between human disease events and air pollution levels. And that it became especially evident in like the 1930s and 1950s, Donora, Pennsylvania, and London smog of, I think it was 52, killed upwards of 2,000 people. And then I think ultimately 4,000 to 6,000 people in the aftermath. And these were acute air pollution events that shocked the world, the modern world, that is. And more recently in the 90s, it became realized that the cardiovascular impacts were the predominant ones of air pollution exposure. That's not to dismiss the pulmonary impacts, but when it came to mortality and grave outcomes, the cardiovascular impacts outweighed those of the pulmonary impacts. So that's how I got focused on cardiovascular. But beyond that, I mean, there's psychological impacts that are being suggested in the epidemiologic literature that are only now being tapped into with respect to animal studies. So the first step in air pollution science is, at least in terms of the health effects, is usually identifying the impacts population-wide. And then establishing a biological plausibility for causality by demonstrating similar effects in animals, and also, and under controlled conditions, also identifying biological mechanisms to kind of confirm that indeed there is causality there. And if you can kind of identify that mechanism and then inhibit it or exacerbate it by targeting the molecules involved, then you've really got a solid case for causality in your observational studies of humans.
Right.
That's the value of animal research.
Right.
But yeah, I mean, the diversity of impacts of air pollution are stunning. And you know, it even extends to crime rates, for instance. So, you know, the list goes on, and I have no question that it will continue expanding in time.
So when you say those things, Alex, the first thing that comes to mind is how is this having this effect? What is it about air pollution physiologically that is causing people to have more myocardial infarctions or heart attacks? I mean, the first thing that comes to my mind is inflammation, but I'm not sure that that's true. I don't think that I know the answer to that. Does the body of science currently have that understanding?
We have a pretty good idea of the predominant mechanisms involved in the cardiovascular effects of air pollution. And the mechanisms are manifold, and that they include inflammation for certain, but also oxidative stress, which typically comes hand in hand with inflammation, although not necessarily. So like pulmonary oxidative stress can lead to systemic oxidative stress, which can adversely impact cardiac function, but also promote the formation of atherosclerotic plaques, the instability of them rupturing into thrombi and therefore leading to infarction. So autonomic imbalance is also another major mechanism, and that is basically the involvement of the autonomic nervous system, which governs or regulates your internal organs, in reflexes to immediate exposures. So these air pollutants, they trigger irritant receptors in the airways and lungs and give feedback to the autonomic control centers in the brain, which then alters its regulation of the heart in arrhythmogenic ways. So it can cause cardiac arrhythmia, it can cause sudden cardiac death, or it can promote an enhanced sympathetic regulation or fight or flight response over the long term. And that can lead to heart failure or atherogenesis as well.
That's really interesting.
That's
so
inflammation,
yeah,
oxidative stress, and autonomic imbalance. And then there's some other ones as well that I could go on about, but I don't want to bore you to tears necessarily.
No, you're really exciting me actually. So with the discussion of autonomic imbalance, are you guys looking at HRV as a measure of that in any way? Because HRV is supposed to be sort of this measure of sympathetic versus parasympathetic balance.
Yeah. So heart rate variability definitely gives us considerable insight on the brain's regulation of the heart, and the autonomic nervous system in general's regulation of the heart. And my lab and in my research, I've been tying alterations in heart rate variability to increased frequency of arrhythmias, spontaneous arrhythmias in animals. And also, we've been looking at heart rate variability changes in smokers and participants in our human cohorts here in Louisville. But one critical thing to consider with heart rate variability is also, can you find some other confirmatory evidence of autonomic imbalance? And a lot of times that includes like urinary catecholamines, like adrenaline and noradrenaline, or their metabolites, or you can look in the blood for those as well. And so that sort of gives you confirmatory evidence that your heart rate variability observations are truly indicative of this autonomic imbalance.
So I've been exposed to pretty bad PM2.5 air over the last few days. Would I expect a short exposure of extreme air pollution to cause immediate effects in my heart rate variability or my risk, for that matter, regarding air pollution?
Yeah, I would say so. The levels that you all are getting exposed to right now, especially if you step outdoors for any length of time, if you exert yourself in the high PM concentrations, those levels exceed even the ones we're exposing our animals to quite a bit, anywhere from probably 2 to 10-fold the levels that we expose our animals to these days when it comes to particulate matter studies. And we definitely see heart rate variability effects in small cohorts of animals. in which we're able to control for all the different conditions that humans can't. So absolutely, I think it would be affecting your heart rate variability. It's not always crystal clear how. Sometimes your heart rate variability may go up, which actually indicates an enhanced parasympathetic regulation. And sort of under basal conditions, under kind of typical conditions, that is indicative of improved health. So that it's not in this case indicative of that, but it can kind of be confused in the process just because of the nuances of heart rate variability. But absolutely, you would expect impairment as well, or reduction in heart rate variability. And a lot of times these things kind of seesaw back and forth over time relative to the exposure levels and the time from exposure.
Yeah, anyone who has an Oura Ring or a Whoop or some device that measures their heart rate variability on a daily basis is aware that you get a pretty broad range of variation in heart rate variability just day to day, based on recovery, based on the quality of your sleep, all these different things. So all of this is obviously at play as well. But just looking at my heart rate variability right now, it looks like I've had about a 3-point drop over the last week, which may or may not be associated with the air quality outside. We've been pretty focused on keeping the air quality inside the home reasonable, which is one of the things that I wanted to talk to you about, Alex, and see if you had any recommendations for the listeners in terms of what they could do to improve the air quality in their home when the pollution outside is so bad.
Yeah, absolutely. So I think your stipulation about when the pollution outside is so bad is a critical one as well,
right? Because
there are a lot of sources of indoor air pollution, but we're talking right now about outdoor air pollution penetrating into your home or your workspace, and so that's the greatest concern at the moment. I'm not going to get into the weeds about radon and cooking and all the other potential indoor sources like VOCs and paints and synthetics. For now, focusing on the penetration of outdoor aerosols into your living space, my general understanding is that usually the PM concentrations outside are about 20 to 50% indoors. So, sorry, of the air pollution level outside, usually indoors you will see 20 to 50% that concentration.
And Alex, real quick, before you go on, just if you could tell the listeners what PM stands for and maybe how we measure air quality in the first place, just a brief aside, if you don't mind.
Absolutely. So particulate matter, or PM, is just suspended airborne particles that could be either solid or they could be in droplet form. And generally the PM, or particulate matter of greatest concern, is fine particulate matter. So that's 2.5 micrometers in diameter. And so 2.5 micrometers in diameter or less is the greatest concern, fine particulate matter, PM 2.5. And the EPA regulates the levels allowable in states according to the National Ambient Air Quality Standards. The major concern about PM 2.5 is that it penetrates deep within the lung. It is fully respirable, and it can deposit not only in the airways, but also in the alveoli, and results in pulmonary oxidative stress. It can actually penetrate the air-liquid interface into the circulation, and constituents themselves can go into circulation and arrive at distal sites, including your heart and potentially also your brain. So fine particles in the air are the greatest concern for particulate matter. And there's PM10 also, which is it includes larger particles up to 10 micrometers in diameter. But generally PM 2.5 is the greater concern because it's more deeply respirable.
And you were saying that something where like 20 to 50% of the pollution that is outside can feasibly sneak into your house, basically.
Yes. Yeah. And it, of course, depends on how porous your home is. which a lot of times is dependent on how old the home is, or potentially how quickly it was made. But absolutely, and a lot of that's contingent upon your filtration system and your HVAC. It's also contingent upon humidity. So there's a whole lot of factors involved that determine how much of the outdoor air makes its way inside. But once it gets in there, there are other considerations about how long it stays. So, I mean, the HVAC I touched on, you've just mentioned you were making a homemade filtration system, which I think sounds fantastically creative and could be quite effective.
Yeah. So just to update everybody, right before this podcast, I was running around all the different stores in my local town trying to find a box fan as well as a large HVAC filter with a high filtration rate, so that I could put the filter on the back of the box fan and just try to create basically a homemade air purifier, because all the stores in town are sold out of air purifiers. Because obviously, the air is going to get into your house, right? And I've taken other steps to try to prevent that from happening. Like I put some saran wrap over the exhaust vents in my bathrooms, and put a trash bag over my fireplace, and just basically trying to close up all the little holes that I can get. But still, air is still going to sneak in, so you got to clean it somehow. So I think it's important to have a good quality air filter, obviously on your HVAC, as well as try to get an air purifier if you can. Do you have any recommendations about air filters in terms of like how good they need to be? Do they need to have like activated carbon on them? I mean, is there any specifics there that you could give people recommendations on?
Well, I'll admit I'm not extremely well versed in this, but I can at least kind of spitball on it a little bit. When it comes to filtration systems and air purifiers, for one, you can talk to HVAC professionals, and some of them will actually know a lot about it, because it's almost their job to focus on at least how to convert your HVAC system into an effective filtration system in a way that doesn't overstress your system, your fan, etc. Because sometimes putting a HEPA filter in your HVAC system stresses your system to reduce its longevity. And that's the last thing some people want if they already have an HVAC system that's on its dying breaths, for it to go out amidst this current situation. But as far as air purifiers are concerned, obviously you need to consider your square footage that you're trying to purify. And even for that matter, ceiling height could dictate the cubic footage of your home. A lot of times a single air purifier is going to be inadequate for the entirety of your home, but they do make ones that can adapt also to your HVAC system and very effectively and efficiently ionize particles and kind of neutralize volatile organic compounds and actually ionize bacteria to make them relatively inert. So ionization is one of the most common approaches to neutralizing the air and improve filtration. When you ionize particles, it causes them to stick to surfaces, and that can be especially beneficial when you're passing them through filters. A lot of the air purifiers will ionize particles, but a lot of times they spit them back out. I'm not saying the most modern ones do, but traditionally that's been an issue. So you ionize the particles, and then they're loose in the air, but they stick to surfaces. So they go to a wall or the floor or random pieces of fabric, and over time they lose their ionization and they get resuspended. So maybe an advantage right now when air quality is so bad is to use even a relatively older air purifier, but make sure to, on better air quality days, open your windows and air out your home. and I mean markedly better air quality days, because you don't want to just like open your window
Right.
when the air pollution levels come down 20%.
Right.
So that's one major consideration. Another is that a lot of the ionizing air purifiers generate ozone, and you don't want your ozone levels to reach extremes, because that can have adverse impacts as well. At this point, I expect that the particles are of the greatest concern. And when you look at the air pollution literature to date, particulate matter is a much graver concern in terms of health impacts than ozone. Important exceptions to that are for asthmatics, especially. Ozone can be particularly problematic.
That brings up a good question. Are there specific people that need to be more concerned about this? I mean, obviously, when numbers are above 500, pretty much everybody needs to be concerned. But what about at lower levels? When we're talking like in the orange or the red, maybe the PM 2.5 level is 100 outside. Which groups are more at risk?
Yeah, so I mean, I guess anybody who watches the EPA or Air Now color code system, they've got the different colorings that indicate, unhealthy for sensitive groups, and there's not really an immediate explanation of who the sensitive groups are, other than like the elderly and children and pregnant mothers. So there are a lot of different diseases that confer susceptibility to air pollution, and chief among them probably is atherosclerosis or ischemic heart disease, prior myocardial infarction. Absolutely is a very significant contributor to susceptibility to air pollution. Heart failure, but even diabetes and underlying hypertension. I think 30% of adults have hypertension. 30 to 50, and like 30% are overweight. So obesity is another underlying risk factor.
So basically everybody.
But of course, yeah, virtually. Although, the folks listening in, I don't know. I mean, you might be, your audience may be more the worried well than the particularly susceptible. But all of us are vulnerable to some extent. However, the elderly, children, and those with underlying cardiovascular or pulmonary disease, COPD, asthma, the list goes on.
And you alluded earlier, Alex, to the concept of production of pollutants inside the home. So not just from outdoor pollution, but also seeing an increase in pollutants from inside the home. And I know personally that cooking is one of those things, but there's other sources of VOCs within the home as well. What sorts of things should people be on the lookout for indoor air pollution?
Yeah, so I'd say it's funny, I'm dealing with a lot of indoor air pollution lately, actually, because I'm kind of improving one of my now two homes. I'm between homes. We're getting ready to move to another home. So we're improving our home built in 1905 and then moving to a home that was built in 1925. And both need a little bit of help. This home that I'm in right now, we're refinishing the floor and painting. And paint is a major emitter of volatile organic compounds that you obviously don't encounter every day, but with the windows shut, you can receive pretty high exposures depending upon the paint that you select. So there are low VOC paints available, and one catch about volatile organic compounds is that actually very little is known about the health impacts relative to how much we know about particulate matter. There just hasn't been the monitoring of volatile organic compounds as extensively. And so the epidemiological literature is not nearly as robust. And there are tons of volatile organic compounds out there. So the science hasn't quite caught up with its potential impacts. And therefore, your kind of precautionary principle and ounce of prevention being worth a pound of cure absolutely applies to VOCs. So paints are a major source. Refinishing a floor can be a major source of VOCs. New plastic things. I mean, a new plastic shower head that we got, I've been smelling that for months, and I know those are VOCs. Usually you can smell a lot of VOCs, and if you can smell it, it's a pretty good indication that it's not going to be beneficial to you. On that note, plug-in air fresheners are chock full of VOCs a lot of times. So I would not recommend air fresheners. I wouldn't recommend scented candles. I'm sorry. My brother calls me a fun vacuum. I used to burn incense all the time, and I've kind of put the kibosh on that because that's another considerable source. So, when your air quality is pretty poor outside and you can't open the windows to ventilate your home, it's an absolutely critical time to reduce the sources of air pollution indoors, such as luxuries like scented candles, but also painting.
So I can't meditate with my incense. I can't paint. I can't buy any new plastics. I can't plug in any air fresheners. And then cooking causes some sort of indoor air pollution as well. Yes.
Yeah. Absolutely. Most people, when they cook with natural gas, that produces a lot of nitrogen oxides, which have known adverse cardiac and pulmonary effects, but especially cardiovascular effects. So, ideally you would have a hood over your range, and ideally that hood would cover the entirety of the range. A lot of hoods are not built to adequately pull the exhaust from the stovetop or the oven. And they're only they cover maybe half of the range. So if you use the back burner, it's usually better. But absolutely cooking is a major source, and it's not just the fuel. It's also the burning and browning of what you're cooking, including oils.
Oh yeah.
So VOCs are emitted, particulate matter is emitted, nitrogen oxides, some carbon monoxide, but really probably the biggest concern would be nitrogen oxides, VOCs, and particles.
I mean, I've noticed this personally just with my own sort of, N of one experiment. I've got a Dyson air purifier that has a sort of a monitor on it, and it turns on whenever the indoor air pollution goes up, right? And I've noticed that when I cook, if I cook on the back burners, it's always way better. In fact, sometimes it doesn't even turn on at all if I've got the vent on, if I've got the hood on. If I cook on the front, and especially if I'm cooking something that smokes a lot, like for example, if I cook with coconut oil, which I pretty much stopped doing for this reason, and because you get so much smoking, the Dyson will turn on almost immediately and go in full blast, which is telling me, basically that I'm getting, a significant amount of indoor air pollution. So I've had almost learned in my own way, how to cook better and not create as much air pollution just by having this purifier that turns on automatically whenever the pollution's bad. And you can kind of get a sense as to how bad the pollution is by what level it turns on to. Does it turn on to a 2, or does it turn on at a level 10, right? So that's been really interesting, just sort of that direct feedback.
Yeah. Actually, I have a little bit of experience, not with air purifiers notifying me of air quality, but there are some home monitors. They're not research grade for the most part, but they can be very informative. There's the FooBot, which I've had the pleasure of using. The FooBot gives you PM 2.5, I want to say carbon monoxide, CO2, which is actually kind of something we're learning a little bit more about, and then humidity. But I've seen the same thing with cooking in my own home as well, using the FooBot. There's also the AirBeam, which pairs with your phone. It's a mobile PM 2.5 monitor. And both of these systems I'm mentioning, they are flawed to some extent, but they can certainly give you some indication of what the concentrations of particles are. And kind of the AQI somewhat mimics the concentrations in micrograms per cubic meter, so that you can, it's not necessarily a 1-to-1, but you can go online and convert from AQI to concentration or from concentration to AQI as you wish.
That that
But you
reminds
can
me of
monitor that stuff real time.
That reminds me of a question that I've been meaning to ask you, Alex. So I've got a Purple Air monitor. I don't know if you're familiar with that. They're sort of a crowdsourced air quality index. You can go to purpleair.com and basically see, people who've put up these monitors in their own homes and communities all throughout the country, and see, what the air quality is outside, or if, for whatever reason they've put the monitor inside their home, you can see what their air quality is inside their home. I typically have mine outside, but during this, these unprecedented fires that we've got, I actually brought it into my home because I was more concerned about indoor air quality right now, because obviously I'm not going outside. But one thing that I've noticed is that the numbers that the Purple Air sensor gives me are consistently higher than the numbers reported by the states. Whether this was true in Utah, and it's true again here in Oregon. Is there somehow a different scale that the government is using as opposed to these home monitors?
Yeah, so probably the primary source of the discrepancy is that the numbers reported, unless it's real time, and even real time by governments, are gravimetric, and so they're going to be generally a lot more accurate. The numbers you get, the concentrations you get from probably almost certainly actually from the Purple, from the Thubot, from Airbeam, and others are optical, and they have certain limitations, especially if there is any humidity or water droplets, but also the dimensions of a particle can dictate how large and how much mass concentration these devices believe there to be, and even the opacity of the particles can dictate that. So there are a lot of limitations to the home monitoring systems. If you really want to fact check the concentrations you're observing, the best way to do it is to get a pump, a hose, and a filter to pull air through the filter and know the flow rate of your pump, and then you can calculate the actual mass change of that filter, assuming you have a good scale. So for you home scientists out there, if you're capable, that's one way to do it. But yeah, gravimetric is the gold standard, and a lot of times it really breaks down in the lab to just weighing filters before and after you do a period of collection, and then back calculating the concentration.
So when you say gravimetric, you're actually saying weighing the filter after running air through it to see how many particles have been picked up by the filter.
Mm-hmm.
Oh, okay.
Exactly.
So, and in this case,
and
you're
usually
actually
you need a cutoff, so you don't collect the really large particles and bias your results.
Gotcha. And in this case, you're telling me to trust the government.
Yeah, I think so. Yeah.
Okay.
I mean, most of the people who work in the air quality divisions are there for a reason, and it's not just they stumbled into a job. It's because they're interested in air pollution. These acute events are, I think, for the most part, people who work in that field have a genuine interest and concern for air pollution. Yes, there could be, who knows, some sort of conspiracy. I find it unlikely. Most conspiracies take too many cover-ups to actually come to fruition.
Yeah, I'm not trying to imply that there's a conspiracy or anything like that. It's just sort of funny. All right. So
these days you have to acknowledge that they exist.
It's a possibility for sure.
Theories, at least.
So one other question I had for you was, one question that I get a lot from my patients and from our listeners is what can they do about this, right? So we talked a little bit about some tips and tricks for your home, covering openings and getting good filtration devices and not going outside, obviously. What about supplements, medications? Are there any other treatments that people can take? I mean, you spoke towards oxidative stress, so it would make sense to me that medications to reduce oxidative stress or activities to reduce oxidative stress might be beneficial.
Yeah. So before I go there, I will say that one of the best medicines available that you cannot take right now is exercise. And that's because you enhance the dose of the particulates and the other air pollutants dramatically when you exert yourself. So to the best of your abilities, you probably should be avoiding exercise when the air pollution levels are high. And that's a critical factor. But if you have been exercising, then you've almost certainly built up a reserve of antioxidants and the capacity to buffer your system, your body, from all the oxidative, not all of it, but from a considerable amount of the oxidative stress that is occurring in you because of these exposures. So presently, try to avoid exercise, going outside where possible. I know it's a lot of times impossible, especially under this pandemic.
What about
crazy,
exercise inside, Alex?
Like I said, generally penetration into a home is 50 to 20% for the PM 2.5, and therefore, when you have these really alarming PM concentrations outside, unless you have an airtight home with really good filtration systems, and you're not seeing levels of concern for PM through your own monitor, I would avoid it still until the air clears. So then if you have your home really well sealed, you may need to be concerned about radon and VOCs. That's sort of the trade-off of having a really well sealed home. But as far as nutrition is concerned, I've definitely come across a number of studies over the years looking at different supplements. And I will say first and foremost that I want to say vitamin C, D, and E, have kind of really interesting results when it comes to smokers. And I know that sounds irrelevant if you're not a smoker, but it is relevant because air pollution at these current levels are comparable to smoking in many ways. And so taking mega doses of vitamin C, D, and E is probably not a good idea, because that has been linked to actually adverse outcomes in tobacco smokers. Mega doses. So, if you take, a modest amount, that may be okay. But I feel that fish oil is one of the few supplements that has a very likely benefit. I also think resveratrol is, and so resveratrol is derived from grape skin, and I think grape seed as well. It's an extract from the grape plant, and it's high in flavonoids. But also, if you like sprouts, broccoli sprouts are something that I've seen pretty impressive benefits to when it comes to air pollution exposures.
Yeah, sulforaphane.
So broccoli sprouts are really, really high in sulforaphane. And actually an ounce of broccoli sprouts is comparable in sulforaphane to like 2 pounds of broccoli itself. So it's kind of a superfood, and I would definitely recommend that. Other diets rich in berries, flavonoids, could certainly have a buffering capacity or improve your buffering capacity. And beyond that, fried foods and highly browned or charred foods, I would recommend against, because they're high in VOCs and aldehydes that could exacerbate the impacts of the exposures that you're getting right now. Trying to think.
That's a pretty good list. I mean, I like that. The only other one I might mention is, what about glutathione? Have you ever seen anything about glutathione?
Absolutely. So glutathione is an essential kind of free radicals scavenging chemical, or it enables the scavenging of free radicals. So it allows for a reduction in oxidative and nitrosative stress. And so glutathione is an essential component in your innate defense against oxidative stress. I don't know anything about dietary glutathione itself, but I do know that intrinsically, internally, your own endogenous glutathione is absolutely critical.
Just for our listeners, so there's several genetic malformations or polymorphisms that lead to a reduction in your own production of glutathione. So there's been a lot of talk previously about people using taking glutathione in different ways. The challenge has been in absorption. So you'll often find things like liposomal glutathione, some people doing like rectal suppositories of glutathione. One way that I've found has been pretty adequate is just actually taking NAC or N-acetylcysteine, which is a precursor of glutathione, and it seems to have fairly good uptake in most patients. So I think that's probably another reasonable low risk option for people trying to combat the oxidative stress associated with this pollution. Alex, my wife has been listening to this podcast the entire time and not saying anything in the background, but just blowing me up with questions. Do you mind if she comes on and asks you a couple of questions?
Not at all. Not at all.
Brittany, are you still there?
I'm here. Can you hear me?
We can hear you.
Yep.
So this has been fascinating. I've been really, as Mike said, jotting down lots of questions as I've been listening. So we're here. We're in Oregon. This is sort of, I don't know, unprecedented bad air quality. And I have 2 young kids. I have tons of friends with kids who are pregnant. I know lots of people who are in high risk groups. They're older. They might have lung conditions. So, I know you're not maybe able to give advice for everyone based on that, but we have concerns about what is this doing to us as a short term. Is this considered an acute event, or if this continues for days, is this considered a more chronic event? What can we do? Obviously, not everybody can pack up and leave. We're doing what we can to improve the air quality in our homes. But I'm interested in, from a data perspective and longitudinal data, what are these long-term health effects? Do we need to be concerned about what this might be doing to our children's lungs?
Wow, that's a great question. And I don't have any solid answers for you immediately, but yeah, I mean, there should be some concern, absolutely. And there could be long-term effects. I would say one of the biggest difficulties with kids is it's hard to get them to slow down. And you don't want to keep them locked indoors, going bonkers, jumping off the walls. You want to let them get outside and play. And it's a balancing act trying to figure out even how to protect them in the first place. But in terms of long-term impacts, there's certainly potential there. I don't have a crystal clear answer other than to say that precaution is absolutely merited. Keep your eyes on the air pollution levels. And it's not always the case that the government monitors are going to represent what your local air pollution levels are, especially if you're near a wildfire. So if you have any means of getting a home monitoring system, that could potentially help you further. Making sure they have good basic nutrition is an absolute. So glutathione, as Mike mentioned it, like just having the precursors to a lot of that endogenous antioxidants, so that they're eating the right foods, healthy vegetables and fruits, that can go a long ways. And
so I should have my kids eat more broccoli sprouts.
Go ahead.
I should have my kids eat more broccoli sprouts. Thanks, Alex.
I'm gonna have the kids call you and you tell them to eat their vegetables.
Well, so one thing, one major issue with the broccoli sprouts in particular is that if you start consuming them voraciously, especially if you're a family in a one room that's purified air, you might discover that you need to escape that room sooner than
all of a sudden the VOCs went way up in that room.
Right. Yeah. So in some people, it definitely causes flatulence. But yeah, so I mean, what to do with kids, or what are the long-term consequences? I don't think there's that much data out there that exists for these acute events. And it's a relatively acute event. The unfortunate thing is that it might be the new normal to some extent,
Right.
with climate change, and if you live out west, especially, which is extremely unfortunate, because it's, you know, such a utopia in many ways in terms of the outdoors. So I don't have any great answers for you, but the best I can recommend is you know, try and improve your indoor air quality. You can always try to bring in things that they would play on outside, and just sort of compromise. Like if they damage the floors a little bit, because you bring in like a freestanding slide, at least they're getting some exercise indoors.
Right.
Like I said, I don't recommend it, but it's better than outdoors.
Right. Well, that brings up my next question. So, I have not exercised or done, any cardio, any intense exercise since the air got bad. But in my mind, I'm thinking, God, what about just some gentle yoga, some stretching? Is that going to be
Absolutely.
beneficial for me? Obviously, I feel like it can't hurt, but right, is the concern that we just don't want to increase our heart rate and our respiratory rate?
Mm-hmm. Absolutely.
Okay.
So I'm glad you went into that, because it was kind of what I was thinking about going into myself. It's so yoga is it's tricky a little bit, right? Because you're supposed to take deep, slow breaths, and you're like, well, do I really want to be taking deep breaths in the midst of this air pollution crisis? But because you're slowing your body down, you're actually promoting a parasympathetic dominance. So we're back to this autonomic nervous system topic. And parasympathetic dominance is sort of like your rest and digest regulation of your cardiovascular system, and it can actually inhibit inflammation. It can reduce oxidative stress, and simultaneously reducing your heart rate, the demands on your internal organs, especially for, you know, pumping blood. And by reducing demands, that reduces your oxygen consumption overall. So your dose is decreased. So overall, it's a beneficial impact, and the after effects include increased heart rate variability, enhanced parasympathetic regulation, reductions in anxiety, and there's all kinds of benefits to yoga and to meditation. And, you know, despite the deep breathing that is commonplace with them, I think overall the benefits outweigh any risk. And it's one of the ideal responses to crises, but also, although I don't know of any science out there that's shown this yet, I would estimate that it's one of the ideal responses to these air pollution events.
Right.
At least, especially meditation. But
yeah,
yoga
I was just going to say, yeah.
Yeah. I mean, yoga can be exertional.
There is research on the effects of meditation and related to different, health conditions. So everybody, meditate your way through this. Do some yoga.
Yeah.
Do what you can.
Yeah. Yeah. And I mean, the yoga itself, stretching your muscles and your bodies, it also stretches your vasculature, so it may add some elasticity to it, to your blood vessels, and therefore reduce the burden on them and your heart. Yeah, so those are huge. I mean, I think another consideration is trying to reduce your stress level in general. And one obvious source to me of stress is, other than being restrained indoors, is obsession with media consumption and screen time, and I'm guilty myself. But that's something that you could try to reduce to kind of recenter yourself and reduce your overall sympathetic influence on your cardiovascular system, and thereby reduce oxidative stress.
So
That's an excellent point. I feel like that's a lot of the same advice that was given, the beginning of the coronavirus pandemic is reduce your exposure to media, and it's becoming a theme.
Mm-hmm. Mm-hmm.
So I
Sorry
feel like
to cut you off, Mike.
I feel like this might be a great Brittany, thanks for jumping on and asking those questions. I think that was really, really valuable. And I think a great point that everybody should try to meditate their way through this because obviously the advantages outweigh the disadvantages.
Well, thanks for letting me come on and ask those questions. It's been really informative.
Yeah, glad to have you. Great questions. And there are other considerations that are lifestyle related, like smoking, vaping, drinking alcohol. Some of the most enjoyable vices that are the worst for you are even worse for you right now, and that's partly because they cause sympathetic dominance and enhance the stress on your cardiovascular system.
Yeah, but nobody ever called you a fun vacuum, Alex.
Yes, that's actually part of my title.
It's part of the long title is at very end, fun vacuum .phd.
Right. Yeah.
No, I think this has been really awesome, actually. I mean, in a lot of ways, it's a lot of these recommendations are extremely similar to the recommendations that we give people for living a healthy life. So if you are a regular listener to this podcast, this is not anything outside of the realm of our normal types of recommendations. Don't drink in excess, don't exercise in excess, get plenty of sleep, eat a healthy diet, including lots of antioxidants, broccoli sprouts, make sure you take all of your vitamins, exercise when you can, when it's safe. I think that's one thing that's very, very different in this particular situation is that we're telling people not to exercise, or at least not to exercise with intensity, unless they can be assured that the air quality that they're breathing during exercise is safe. And then I think some really great recommendations around, things to do in your home and things to watch out for. So how do you cook your foods? Do you cook your foods during, an acute air pollution event outside? And then when the air is okay outside, making sure you're opening up your windows, getting rid of the VOCs inside of your home, and cleaning out the air quality inside of your home, including like the gases that off-gassing from new plastics and of course, radon and things like that. So, and from my perspective, go ahead.
One other thought is when you're in the car, because we haven't mentioned this at all, it's usually best to recirculate the air, and that makes a big difference.
Mm-hmm.
Now, if you have a brand new car, there's going to be VOCs emitted, but generally the benefits are astronomical on reducing particles when you recirculate your air. So to the best of your abilities, recirculating the air in your car is important.
I feel like because of COVID, everyone and their brother has a mask these days. And one thing I've been seeing is people out exercising in this with, the air quality in the 500s wearing like a respirator. Is there any safety to that, or is that just complete insanity?
Any added safety or reduced safety? I have my high doubts about any benefit unless you're in a crowded area of running with a mask on, because for the most part, if you have space to run, as long as you're maintaining, if you want to be extra cautious, like 10 to 12 feet from anybody, if you're outdoors, you should be fine. You're also generally running past anybody. It takes a sort of a critical level of exposure to the virus to achieve infection, and you're rarely, if ever, going to get that exposure as you're running past the source.
Yeah. That
unless they're running in front of you and you're running in tandem, you should be fine. Or you're in a densely populated area like New York City or something.
What about air pollution? Would there be any advantage from that standpoint to wearing an N95 or a respirator of some sort?
Yeah, I could definitely see it. I would suggest trying to balance your exercise load according to your mask. Like, don't expect to be able to exert yourself nearly as much.
Mm-hmm.
But if you are so dead set on exercising outside, wearing an N95, I think, is a good idea. And even one with a valve, which is, not recommended for preventing transmission to others.
Mm-hmm.
So you shouldn't really be wearing those with, as a preventative measure otherwise. But it will give you the opportunity to exhale more efficiently,
right?
And thereby breathe better. But there are other risks, like the harder your respiratory demands are, the higher your cardiac risk if you have an underlying disease. 1 in 2,000 live births have long QT syndrome, and so that's like a abnormality in their electrocardiogram and their
Mm-hmm.
cardiac conduction that makes them susceptible to sudden cardiac arrest. So you can see an otherwise perfectly healthy person under certain conditions, like strenuous exercise, just keel over and die because their heart went into fatal arrhythmia.
Wow, 1 in 2,000, really? That seems high. That's crazy.
1 in 2,000 live births. Yeah.
Wow.
So that's
I have
not
to jump
necessarily
in here.
one.
I felt like we were ending on a positive note about let's all meditate, and now we're talking about people suddenly dying. It's okay.
They call me the Dyson of fun.
I wanted to ask another question. So we're talking about healthy eating. I have a wonderful garden in the back. I'm thinking this is great, and we're all gonna eat, a salad for lunch. And that made me think, can this particulate matter, can this get into the soil? Do I need to actually be concerned about the vegetables that I'm growing and getting ready to eat? Is this, or this is a topic for another podcast?
No, it's a great question. I mean, briefly, I can say that, these fires, they generate aerosols from all kinds of substrates. So, homes are burning and tires are burning, and like all these different materials, a lot of them synthetic, are going up into the air. It's not just wood or grasses. So there's a lot of seriously toxic stuff going into the air. The good news is that, generally speaking, your gut and things that you eat has a much greater your body has a much greater capacity to handle them, because those compounds pass through your circulation to your liver and generally get metabolized towards detoxification. And so in contrast, your lungs, they don't have a liver, right? So when you expose your lungs by inhalation to a lot of these nasty things, it's far worse. But yeah, wash your produce. These things can get into the soil, and they could be pulled up by your produce as well. They're going to be generally at the surface. So, if you want to be extra precautious, it's not really planting season, but maybe come next planting season, you could always, if you had a really bad fire nearby, try to scrape off the top, I don't know, half-inch of your soil, but it may wash down.
Point. Okay.
Yeah.
I haven't even thought about the future effects for next growing season, but that's an excellent point. I feel like I could just keep asking questions, so I'm going to mute myself again so that you guys can wrap up wrap this up at some point. I remember the very beginning of this, we said, 30 minutes, and here we are an hour and 15 minutes later.
Yeah, actually, I tried to.
Soon enough, you'll hear my wife come in.
It's fascinating.
The whole thing.
It's mostly my fault. I tried to wrap it up, and I think I had a really good wrap up there going, and then I thought of another question. So
if you were going to wrap it up, you should not have brought me in. I'm just saying.
I think this is a. Thanks, Brittany. I think this is an excellent time for us to wrap up, Alex.
Yes.
Um,
Cover us in a hermetically sealed cocoon of saran wrap,
right.
please.
Right. We're gonna wrap ourselves up from the air pollution outside and inside, and see if we can't get through this all together. I do want to take just a quick minute to thank all the firefighters out west that are working very
Absolutely.
hard to stop all these fires, and our heart goes out to people who've lost lives and homes with what's going on right now. Alex, thank you so much for being on the podcast. I would like to have you back in the future at some point, because one thing that we did not get into that I would really love to talk more about is a little bit more into the physiology, especially regarding insulin resistance. I think that's just extremely interesting. So maybe in the near future, once we put out some of these fires, so to speak, we can have you back on the podcast.
Absolutely. My pleasure. Thanks so much for having me. And yeah, my heart goes out to everybody, especially those out there fighting the fires on the front lines. Thank you.
All right. Thanks, Alex. Everybody have a good day. Thanks for listening to the Wild Health Podcast. If you found it helpful, give us a 5-star rating and write a review on iTunes. It really helps the podcast, and we greatly appreciate it. If you want to be a client or you want to work with us, go to wildhealth.com. Thanks again.